Hi, I'm Dr. Larry Bruchette, MD, and welcome to your weekly Corona Update. Together with physicians Dr. Katrin Sadiq, MD, and Dr. Kathleen Montgomery, MD, we will summarize what you need to know regarding the facts and evidence for coronavirus in 5 minutes for this week, June 11th, 2020. Now, to start with the current case numbers, we go to Dr. Katrin Sadiq.
There are just under 7.5 million total cases of COVID-19 and over 417,000 deaths. In the United States, we reached over 2 million total cases of COVID-19, including 150,000 new cases over the past 7 days. We had 12,000 more deaths, bringing our total estimate of over 113,000 deaths. The number of cases in Africa alone has doubled in the last 18 days, exceeding 200,000. The pandemic is also sweeping through Latin America and the Caribbean, leading Dr. Etienne, the director of the Pan American Health Organization, to state that the virus had, quote, pushed our region to the limit, end quote. Despite a surge in coronavirus cases, India has lifted its lockdown, opening up large gathering areas including markets, shopping centers, and religious sites. Last weekend, India surpassed Spain in number of infections, now the 5th worst affected country in the world.
This week, a WHO official, Dr. Maria von Kerkhove, claimed that asymptomatic spread of COVID-19 appears to be very rare. This contradicts the published data and challenges the premise of social distancing and lockdown, so it made major waves among medical professionals. Dr. von Kerkhove has since walked back her statement, distinguishing asymptomatic people from pre-symptomatic people. Her contact tracing data, which is not yet public for review, suggests that people who never show symptoms are not major spreaders of disease. However, multiple research studies have found that pre-symptomatic people, those who feel healthy now but go on to develop symptoms later, are a significant source of COVID-19 transmission. One such study, published in Nature, found that 44% of new cases were due to pre-symptomatic transmission. Dr. von Kerkhove's clarification is crucial because it means that someone who's feeling well or mostly well is still fully capable of transmitting the virus. So even if you feel fine, wash your hands, continue to socially distance yourself, and wear a mask in public places to protect yourself and those around you. Now back to Dr. Bruchette.
Thank you, Dr. Montgomery. With millions of people going back to work and many protesting racial inequities across the country and the world, you may be wondering, are we done with social distancing? Actually, it matters now more than ever. You remember the rules. Stay at home if you're sick, wear a mask, maintain social distance, wash your hands. These are going to be in place until we've got a vaccine, which is likely months, maybe years away. Now, the other half of the strategy is to slowly reopen things one step at a time, continuously monitoring your local case numbers of coronavirus. Now, with more information on the local case numbers, we go back to Dr. Sadiq. Doctor?
Thank you, Dr. Bruchette. Now let's talk about state reopenings. Currently, all but 3 states have fully reopened in some capacity. California, Oregon, and Tennessee have regional reopenings. States like New York and counties in California are proceeding with great caution, currently in phase 1 with major restrictions. Other states like Oregon and Florida are in phase 2 with businesses up to 50% capacity. Indiana and Texas are in phase 3, with Texas allowing outdoor gatherings of 500 people in restaurants at 75% capacity. Mississippi has decided to skip the phases and jump straight into full reopening. Many people wonder what impact such varied approaches to reopening, combined with nationwide protests at different scales, will have on new COVID-19 infections. The New York Times offers multiple visual guides to explore this relationship. Take some time and check out trends in your own state. And how are the states doing? While nationwide, new cases are flat, around 20,000 per day, each state has its own story. The Johns Hopkins Coronavirus Resource Center visualizes trends. I recommend you check it out. California, Texas, Florida, Utah, and the Carolinas, along with 9 other states, are seeing increases. Arizona, which had 1,300 new cases just today, and South Carolina have had sharp spikes. About a dozen states, including New York, New Jersey, Massachusetts, and Georgia, are seeing noticeable declines. The rest are flat. We are also seeing it's no longer just big coastal cities that are heaviest hit, but also smaller cities and rural communities in the Midwest and the South. Lake County in Tennessee and Buena Vista County in Iowa have the highest number of recent cases per resident. This is concerning because many smaller communities lack the medical resources, including ICU beds, to handle a spike. Now back to you, Dr. Montgomery.
Thanks, Dr. Siddiq. Now let's move on to antibody testing. Your body makes antibodies in response to viruses and bacteria to help you fight infection. Having antibodies to COVID-19 means you were infected at some point in the past. The idea of testing for antibodies is attractive because it can help us figure out how many people have been infected and potentially determine who's immune. There are two major hurdles facing antibody testing right now. First, antibody tests can show false positives from cross-reactivity with other viruses or medications. Some of the common culprits are the strains of coronavirus already circulating in the population that cause the common cold. False negatives are not much of a problem with these tests. Secondly, because not many people have antibodies to COVID-19 yet, a positive test is more likely to represent a false positive than a true positive. Even with a sensitive and specific test, we will have a lot more false positive results if not many people have the antibodies. One published study found that if 1% of people have antibodies to COVID-19, the test will produce a whopping 86% false positive rate. This means that even with a positive test, your chance of actually having the antibodies is only 14%. As more people become exposed to the coronavirus and develop antibodies, the chance that a positive test means that you actually have the antibody will increase. Because of the high rate of false positives, for now, antibody testing should not be used to make decisions for individual people. The WHO agrees on this. We are not yet ready for immune passports. For now, these tests are mostly useful for epidemiology, learning how the virus is spreading through populations, but not to determine whether it is safe for a single person to go back to work or visit their elderly relatives. Now back to Dr. Burchett.
Thank you, Doctor. Let's talk about treatments for a second, specifically the experimental antiviral treatment of Remdesivir. Say it with me, Remdesivir. Remdesivir. It's an IV medication that's given that stops coronavirus's replication, specifically at the level of the RNA when it's piecing that together. Now, initial studies in the lab, in vitro, showed that it does appear to stop the virus. But one of the first studies in the Lancet showed that that didn't translate to people getting better in the hospital when they were sick. Now we've got a study, May 22nd, the New England Journal of Medicine, that showed a 10-day course of Remdesivir, people that got it got better at day 11 as opposed to 15. That's 4 days faster. And the mortality went from 11.9% down to 7.1%, or decreased by 40%. Now, while these numbers weren't statistically significant, and we do need more studies, that was very promising. Now, there was a follow-up study, May 27th, that I want you to know about, which compared 5 to 10 days of this medication and showed 5 days is probably just as good as 10, which matters because it looks like the 1.5 million donated doses of this medication from Gilead are running out, and that this treatment course costs somewhere between $4,000 and $10,000. Say it with me again, Remdesivir. Keep an eye on this because it's probably going to be part of treatments moving forward. In conclusion, with Dr. Catherine Siddiq and Dr. Kathleen Montgomery, I'm Dr. Larry Burchett. We hope you have both enjoyed and found value in watching the Coronavirus Weekly Update. Please share it and check out more of the information and evidence on averpoint.com. Stay safe, and we'll see you next week.